Upon entering the honorable ranks of the dental community, I swear to uphold, to the best of my ability,
I knew I wanted to help people.
I wanted to change lives, to make a real impact.
I want to definitely get rid of pain.
Definitely want to make people smile.
I want to give back to the community.
I can be a healthcare provider and I can be a leader in my community. This is what I've always wanted to do.
I knew as a little girl that I wanted to be a dentist.
I will at all times act.
Every autumn, the first-year class at the University of Michigan School of Dentistry recites the oath of aspiring dental professionals. For these dental students, the oath is a pledge, a promise, a commitment to themselves, faculty, alumni, and the communities they will serve to practice the art and science of dentistry with determination and pride. The oath is also an invitation, a challenge for today's dental students, like generations before them, to seek and create their own opportunities and to continue the rich legacy and traditions of leadership, research, community outreach, and an education based on personal hands-on learning and discovery that can only be found here at the First Dental School in Michigan, one of the oldest and most respected dental schools in the country, the School of Dentistry at the University of Michigan in Ann Arbor.
Remember about what we talked last week about...
There's a lot of other good schools out there, but Michigan has always been the choice for me.
U of M's got a great reputation.
Now, these areas that we are talking about...
Worldwide reputation.
And in between that...
A reputation for turning out the best of the best.
So that is what we can control.
Our expectation is that everybody who graduates from this institution is a leader.
Good afternoon. This is my case presentation.
A leader in their community, a leader in their profession, and one that we think should have a national impact on the profession and the health of our population.
The faculty at Michigan are really leaders in their respective areas and disciplines.
A lot of the faculty members were actually world-renowned dental researchers and clinicians.
I think what you're looking at there is actually a functional repositioning of the mandible.
First, we'll do the sealant exercise.
They're not just teachers.
We're going to just be using brush and water.
The faculty challenge you. They challenge you as a class. They can challenge you individually.
What do you think probably happened?
They ask questions to facilitate your thinking prior to giving answers.
Now we're going to go ahead and we're going to look for caries.
Any school can teach existing knowledge, but at Michigan, and an expectation of the faculty, is that we will also be involved with creating knowledge. That is, finding questions that have not yet been answered.
We're going to go ahead and re-etch.
The University of Michigan teaches the science of dentistry.
So what you're just looking for is if you compare it to the regular tooth?
It is a foundation of knowledge about not only the mouth, but about the body as a whole.
Michigan has had a very long-standing reputation in the area of clinical research. So when you take that section through there, many of the early clinical research studies in the field of periodontology, the first ones were performed here at the University of Michigan. And then compare that.
Research is really at the heart of the mission of this school.
There you go.
If we don't have the answer, we have to discover it. No, this will be okay.
It's critically important that we have students involved in the laboratory.
So these bands here, what?
It's really a team approach. The student might be working with a faculty member in a clinical research project, interacting with research subjects or patients, helping collect data and information. And so it's a really good opportunity for them to experience the full range of research opportunities.
One of the first questions I asked at my interview was clinic exposure. How much clinical exposure am I going to get here?
I'm going to lean you back again, okay?
Our students go into the clinic their very first semester.
I'm just going to check some of the probing depths.
So they get their hands on and hands wet immediately.
Let's look at the occlusion today and maybe adjust the bite on it.
They start working on each other for starters to get used to actually working on a patient independently.
I think we've got two options on how to deal with that.
I think one thing that sets U of M apart from anybody else is we have what's called the VICS clinic system, vertically integrated clinic system. That's where all levels are together. First, second, third, fourth year dental students, along with the dental hygiene students here.
So I think I'm going to go with that, all right?
I think that's one of the benefits of the students working in the clinic early here at Michigan. We talk about things in class, we do procedures in the pre-clinic, and then they go to the clinic and they see some of that being done on real live people, and it makes it come together for them.
Some days I'm a clinician, some days I'm a student in the classroom.
I'm a kind of learner who needs to have a hands-on experience to really get it through my brain.
Open real wide.
I think it's a lot different working on a real patient than reading about a hypothetical patient in a textbook.
So we want to engage that pen with that material as much as we can now.
One-on-one contact with my patients.
How are you doing so far, Mabel? Are you doing okay?
Hands-on.
Out there with the patients in the real world.
Okay, we're all set. Very good.
We want students to be able to think about what they're doing and understand what they're doing instead of just doing something because that's the way that they did it in dental school.
Intraorally,
I would describe the dental hygienist as the preventive oral health specialist.
Number 19, I found sub.
They're really the individual on the dental team that
Number 25,
focuses on helping people achieve wellness and preventing disease.
Was changed from before? No changes from before.
The uniqueness for us is our dental hygiene students and our dental students are really learning side by side. So in our educational program, we are modeling what we think is private practice. They're a team when they're in school so that when they go out into their offices and their practices, they know how to be a team.
Our students, as a part of their training, they're actually going out into communities in Michigan, and they're treating the public, and they're making a difference outside the school as well.
Outreach. It's bringing care to the community and providing them with the resources we have here and bringing it to the patient.
I think it's a great way to serve the underserved areas and the underserved parts of Michigan that don't necessarily have a lot of private practitioners in the area. And I think the fact that students can go out there, I think it's a win-win situation for everybody involved.
When students can go and practice some of the things that they've learned in actual small-town clinics, I think they can understand better how they fit into the whole healthcare structure that way.
You can't get it from a book. You just have to get out and find out what the real world is all about.
When your appointment is and where?
I think Paul's done a fantastic job.
So what you been up to lately, huh?
Got basketball tryouts coming up.
Yeah?
He seems to take a real interest in Mike. You know, he always asks how he's doing, as far as like brushing his teeth, how things are going at home, is he having any trouble?
You okay? A little tight?
It makes me feel like he's really involved in Mike and he cares what he's doing with him.
My first restorative procedure, I restored all of the lower anterior teeth on a woman, and when I got done, she cried. She said, "I'm right on my way to a big, beautiful smile again," and I was on cloud 9 for the next week. I felt so good.
The public has given us dentists the privilege to practice dentistry, and we are here to serve the public. I can tell you all sorts of fancy scientific terms like periodontology and distal wedge modified Widman flap procedure and all of that. When all is said and done at the end of the day, we're here to serve the public.
University of Michigan School of Dentistry provides opportunities for success at many levels.
I was looking for a school where I could do anything.
They have opportunities from day one to see exactly what it is to practice dentistry.
I wanted a school where there was research, there was clinical opportunities. I just wanted everything available, the opportunity to specialize, the opportunity to go into teaching.
The University of Michigan allows the creativity and the ability for you to blaze your own trail.
It feels really good to know that you played a part in making somebody happy.
Giving back someone's smile.
Be there for my patients when they need me.
Give back to the community.
It's about making a difference.
A big difference.
The Michigan difference.